I've spent years sitting face to face with patients, thousands of conversations, thousands of stories, but there is one moment that has never left me. It was a quiet afternoon. The examination room was still. Across from me sat an older woman, her hands shaking slightly, her eyes filled with fear she couldn't hide. She leaned forward and said in a soft voice, "Doctor, why can't I remember my own daughter's name?" Each word came out slowly, her voice breaking as she spoke. She wasn't talking about misplacing her keys or forgetting where she parked. This was something far more serious, something deeper, something that shakes an entire family, every 3 seconds, somewhere in the world. Another person develops serious memory loss or early cognitive decline. That means tens of millions of seniors each year suddenly face a brain that no longer works the way it once did. But here is what most people are never told. Aging by itself does not explain all of these cases. Many older adults experience rapid mental decline not because their brain is naturally failing, but because something in their everyday routine is quietly interfering with the brain's chemistry. Inside your head are roughly 86 billion neurons. These cells send electrical signals that create your memories, your emotions, your personality, your sense of time, and your sense of who you are. But when certain medications disrupt the chemicals these neurons depend on, those signals weaken, connections break down, information slips away, the mind becomes cloudy, slow, or frighteningly empty. This video exposes 9 medications that have been strongly linked to rapid memory decline in adults over 60, and the specific brain chemicals they interfere with. If you or someone you love takes any of these drugs, it's important to pay close attention. Memory decline isn't simply forgetting, it's a breakdown in the brain's electrical network. Picture thousands of wires inside a computer slowly coming loose. First, a small glitch, then delays. Then major failures, many seniors describe it as a dimming of the mind. Some say it feels like walking into a room and forgetting not only why they went there, but what day it is, where they are, or who they meant to call. The brain relies on neurotransmitters, chemical messengers that allow neurons to communicate. The most critical for memory is acetylcholine, but dopamine, serotonin, glutamate, and GABA also play major roles in learning, clarity, focus, and emotional balance. When a medication blocks, lowers, or interferes with these chemicals, the entire memory system becomes unstable. This is why certain drugs affect older adults much more strongly than younger people. As we age, the brain becomes more chemically sensitive. Even small disruptions can feel overwhelming. Doctors call this drug-induced cognitive impairment. It can look exactly like early dementia, but the cause is different, and in some cases, it can improve if the medication is identified early. Let's go through the 9 medication groups. Medication 1. Strong anticholinergic drugs. These medications block acetylcholine, the chemical essential for forming and retrieving memories. When acetylcholine levels drop, communication between brain cells weakens. Seniors may forget recent conversations, repeat questions, or feel lost in familiar places. They may struggle to follow instructions, multitask, or think at their usual pace. Anticholinergic drugs appear in treatments for allergies, stomach problems, bladder issues, muscle spasms, certain antidepressants, and nighttime sleep aids. The risk increases sharply when more than one anticholinergic medication is taken at the same time. Research shows that the combined effect called anticholinergic burden dramatically raises the risk of cognitive symptoms, even over the counter. Products add to this load. Inside the brain, acetylcholine works like a switchboard operator. When it's blocked, the switchboard goes quiet, signals weaken, thoughts become harder to reach. Seniors may feel mentally slow, confused, or emotionally Distant, medication 2, certain sleep aids. The brain needs deep, natural sleep to repair itself and store memories. Some sleep medications sedate the brain but disrupt REM sleep, the phase responsible for memory consolidation. Without REM sleep, daily experiences never fully register. Seniors may wake up disoriented, forget conversations or appointments, and feel as if they're living in a fog. Many describe mornings as waking inside a haze. These medications also slow brain waves. When brain activity is overly suppressed, short-term memory is often the first thing to suffer. Forgetting simple tasks like turning off the stove or locking the door can become common. Medication 3, benzodiazepines. These drugs strongly increase GABA, a calming brain chemical. While this reduces anxiety, it also suppresses learning, memory formation, and problem solving. Over time, seniors may struggle to concentrate, think clearly, or form new memories. The brain can become dependent on the drug to maintain calm. As natural memory pathways weaken, seniors may forget conversations minutes after they occur or struggle to recall familiar names. When combined with other sedatives or alcohol, the cognitive effects increase dramatically. Long-term use in adults over 60 is strongly associated with cognitive impairment. Medication for strong painkillers, opioids don't just dull pain, they interfere with attention, alertness, and the brain's ability to record new information. Seniors often describe feeling mentally slow, unfocused, or emotionally numb. High doses can also reduce breathing, lowering oxygen levels in the brain. Even small reductions in oxygen can significantly affect memory in older adults when taken frequently or at higher doses. Temporary brain fog can turn into persistent confusion. Medication 5, certain antidepressants. Not all antidepressants affect cognition, but older tricyclic types and those with anticholinergic effects can significantly dull mental clarity. They interfere with serotonin and acetylcholine, leading to dry mouth, drowsiness, confusion, and delayed recall. Seniors may feel emotionally steadier, but mentally slower. They may lose words mid-sentence, struggle with planning, or feel overwhelmed by simple tasks because depression itself affects memory. It can be difficult to separate medication side effects from the condition, making close monitoring essential. Medication 6, allergy and cold medications. Many seniors don't realize that common over-the-counter allergy pills contain strong anticholinergic ingredients. These medications were never intended for long-term daily use in older adults. They can cause fogginess, slowed thinking, forgetfulness, and poor focus. Because aging kidneys clear drugs more slowly, these medications can build up in the body. Even short-term use may cause noticeable cognitive changes, especially when combined with prescription drugs that have similar effects. Medication 7, bladder control medications. Drugs for overactive bladder are among the most overlooked causes of memory problems in adults over 60. They work by blocking acetylcholine to relax bladder muscles, but the same chemical is essential for memory. Seniors taking these medications often report confusion, disorientation, trouble following conversations, and sudden blank moments. Families may fear dementia, but once the medication is adjusted, symptoms often improve. The key is recognizing the cause early. Medication 8, certain heart medications. The heart and brain are tightly connected. Some heart drugs can slightly reduce blood pressure or heart rate, lowering oxygen delivery to the brain. Even mild reductions can cause mental fatigue, confusion, and short-term memory issues. Some heart medications also cross into the brain and affect neurotransmitters linked to attention and focus. Seniors may feel mentally slower or emotionally flat. The risk increases when multiple medications interact. Medication 9, anti-seizure drugs. These medications calm electrical activity in the brain. While that prevents seizures, it can also slow communication between neurons. Seniors may experience slowed thinking, difficulty concentrating, trouble recalling details, and a sense of mental distance. Drowsiness and fatigue further worsen memory performance, especially with long-term use. As we age, the body clears medications less efficiently, kidneys slow down, liver enzymes weaken, body composition changes. Drugs remain in the bloodstream longer and reach higher levels in the brain. The blood-brain barrier becomes more permeable, allowing chemicals easier access to brain tissue. Neurons recover more slowly from disruption. When seniors take multiple medications, the risk multiplies. To drugs that seem harmless alone can cause serious cognitive decline together. Many seniors with rapid memory loss are not developing true dementia. They are experiencing medication overload, and they don't realize it. Every year, countless older adults are told they may have early dementia when the real cause is hidden in their medication list. Families panic. Lives change. But when medications are reviewed and adjusted carefully, many seniors regain clarity, focus, and memory. This is why awareness matters. Memory decline should never be dismissed as normal. Aging until every medication prescription and over-the-counter has been carefully examined.